Man, woman, birth, death, infinity.
Good afternoon, and welcome to the Your Health television program here on AMP's Cable Channel 24 and on the internet at www.ampmedia.org. Join our rotating host and their informative guest live every Monday afternoon at 4 o'clock. The purpose of the Your Health television program is to help get, make, and keep listeners and viewers like you healthy. And now, ladies and gentlemen, on with the program.
Welcome to the Your Health television program hosted by the Monterey County Health Department. I'm Emily Sciolto, your host today, and just about every third Monday of each month. During the past 20 years, there has been a dramatic increase in obesity in the United States, and rates remain high. Obesity costs this country about $150 billion each year, or almost 10% of the national medical budget. Obesity is epidemic in the United States and a major cause of death, attributable to heart disease, cancer, and diabetes. The most recent national data on obesity prevalence among U.S. adults, children, and adolescents show more that 1/3 of adults and 17% of children and adolescents were obese in 2009-10. Not one state has been able to meet the nation's Healthy People 2010 goal of lowering obesity prevalence to 15%. In fact, the number of states with an obesity prevalence of 30% has increased to 12 in 2010. That's an increase from 9 states. At its simplest, obesity results from people consuming more calories than their bodies burn, but it's a much more complicated problem than that. Obesity is common and costly. Its prevalence varies across states and regions. It affects some groups more than others, and like many health problems, socioeconomic status and environment play a role. Today, we are going to hear from 3 guest experts who are all working in various ways to reduce prevalence of obesity in Monterey County. With that, I'd like to welcome my first guest to the program. Sitting across from me now is someone you may recognize, one of my favorite guests to have on the program, Monterey County's Deputy Health Officer, Dr. Lisa Hernandez. Welcome, Dr. Hernandez, and thank you for being here.
Hi, Emily.
So let's start at the beginning. What causes childhood obesity?
Well, I think you said it in the introduction that, there's a simple answer to that question, and then there's a more complex answer to that question. The simple answer is that kids, are eating more calories than they are spending, than they're kind of burning off with physical activity. The more complex answer includes other things that contributed to obesity, including genetics, behaviors, family and cultural ideas. All those factors come in and they cause obesity. And one point I want to bring up is that I want to focus a little bit on childhood obesity, because what we see, and this is a striking fact that I don't know, I just can't forget, is that kids and adolescents that are obese have an 80% chance of being obese as adults. So we really need to get a handle on childhood obesity first. And then that will reduce those numbers that you talked about here in California and nationally. So some of the other factors, the behavioral things that contribute to obesity, are things that are preventable but are really kind of tough. Eating healthy and being physically active. When you look at some of the data, about 25% of kids and adolescents don't consume the 5 fruits and vegetables that we're supposed to eat. I will say that my kids sometimes fall into that category. It's kind of tough to get them to eat those types of things every day. And about 1/3 of kids aren't physically active like they should, again, with the recommendations. What we also see is that genetics plays a role, and kind of plays into what I mentioned before about if you're obese as a kid, it runs into adulthood. Well, what happens with your parents influences what happens with kids. And if there's one parent that's obese, you have a 50% chance as a child to be obese. If you have both parents, that are obese, you have up to 80% chance. So the odds are really against you.
Yeah, and it sounds sort of unfortunate for the child if both of your parents are obese, because not only do you have that 80% chance to be obese as a child, but then if you are, you have an 80% chance of being obese as an adult. So it really does kind of, seems like it could run in the family.
Yeah.
How is childhood overweight and obesity measured? How do you know if some child is obese?
Well, we use an index called the BMI, the body mass index.
Okay.
Okay. So I'll tell you, it's a formula. It's not super complicated, but it's something that you can do yourself. And there's lots of things on the computer, and the doctors use it. And for adults, it's just a simple formula of your weight, and if you're using pounds, weight in pounds, by height in inches. And then you have to multiply that number by 703. And that gives you a BMI, your body mass index. And depending on where you fall, tells you whether you're underweight, normal weight, overweight, or obese.
Okay.
And the magic numbers, or at least the ones that I look at, is when you're normal if you're between 18 and about 24.9. If you're 25 and above, you're overweight, and 30 and above, you're obese.
Okay.
And that's for adults.
Okay.
For kids, you use that same formula, but you apply it to a percentile. I don't know if you remember in doctors, when you were younger, not too much younger, but when you were younger, we had the growth charts, and with babies you measure the length and the weight and the head circumference. When you're a kid, you just do height and weight, and it's specific by your age and specific by your gender. So there's a different scale for the girls and the boys, and based on your age. So you plot your BMI using that same formula onto those growth scales, and that tells you whether your child falls into certain percentiles, and that will tell you whether your child is normal weight, overweight, or obese. So
Okay.
for that piece of overweight, if you're above the 85th percentile, you're overweight. If you're above the 95th percentile, you're obese.
And that's for girls and boys?
For girls and boys, so that category follows the same, but it's just a matter of where you fall on the plots based on your sex and your age.
Okay. So definitely want to have one of those for children if you're trying to measure this.
Yeah, and really those things, I think on the web it's all calculated for you, but really your medical provider does that when he or she sees your child in the office.
Okay. Perfect. So we talked a little bit about the likelihood of being obese as an adult when you are obese as a child, but what are the consequences of childhood obesity, some of the health consequences?
Well, one thing I want to say too is with this epidemic, the sad thing is that we're maybe raising the first generation that's not going to outlive their parents. You hear that a lot where, I never want to see my child die. That's on an individual level, but that is what I would say as a public health official. I never want to see our children die before me. And that's kind of what we're seeing, because these health consequences of obesity are pretty significant. Physically, we're seeing kids more and more with having those things that we think of for adults. Type 2 diabetes.
Oh.
So not the juvenile diabetes that we used to hear about, but we're hearing about diabetes due to being overweight. And that's due to the fact that our bodies are not being able to process, or the child's body is not able to process the glucose, the sugar load. We're seeing kids having high cholesterol.
Oh.
And high cholesterol is a risk factor for having heart problems, cardiovascular disease, and stroke. So these are some of the things that we're seeing with kids. We're also seeing that they could have problems with sleep apnea. That's also associated with obesity, where the kids aren't able to sleep well because of the excess weight, especially around their necks. They're having joint problems, like arthritis. These are things that we think of older adults with. And then there's other issues that are not physical but also impact children. Psychological, they're more, if they're obese, they're more likely to be depressed, having problems with self-esteem, and having some of the social consequences. So all those things are impacted by being overweight.
Wow, you just said a lot of quite a few things that stuck with me. I don't know which one to comment on first. I feel like maybe instead of using older adults for some of those new drug commercials, oh, my doctor says I have high cholesterol, my doctor said I'm experiencing joint pain, perhaps we should start using, 8-year-olds. It might make more of an impact, because that's what I'm thinking of, based on what you just said.
Yeah, I mean, a lot of these things that are tough for parents to see, it used to be great to see a happy, chunky, chubby kid. Remember that? Well, you might not. The Campbell Soup kids. They were round-faced cherubs, and that was supposed to be healthy. Well, really, these impacts are pretty significant and long-standing. There's a new study that just came out last week it was a combined study with UCLA, University of Missouri, and University of Vermont. And this is one of many studies, but they followed kids, about 6,000 kids, and they found something that we worry about, is that obese kids aren't scoring well as non-obese kids on school performance.
Oh.
And
so standardized testing.
Exactly, the standardized test. So they're not doing well with their math, they're not doing well with some of their cognitive reasoning. And I mean, it's one study, but it's other studies before this have confirmed that as well. So that's the other impact that we're seeing, is that there could be there's a potential that kids' IQs and grades are going down. One reason could be poor self-esteem. The other is maybe they're not eating well. They're not prepared to take the test. I don't know if you remember, but I always slept well the night before a test.
Parents made me a good breakfast beforehand.
Exactly. So if they're not getting that, then they're putting themselves at a disadvantage.
Interesting. So it goes a lot further than just the physical being. So tell us a little bit about the problem here in Monterey County. I mean, is it a problem? And why? Are we doing okay? Or where are we in Monterey County in terms of obesity?
Well, yeah, we are not doing very well. And some of the stats that you gave already, the statistics, kind of run true here. Another study that just came out as well through UCLA, which looks at the FitGram, the child fitness test that is given in 5th, 7th, and 9th grades. And that test was analyzed by the UCLA researchers for about 250 cities in California. And Monterey County and the cities within Monterey County didn't do well. California's rate of obesity for those grades was about 38%. Monterey County was about 45%. It was 44 and change for these kids. So the state isn't doing well. The county isn't doing well. And what that study did was looked at specific cities, and still within that range, the city of Monterey was 41%, and that was the best in the county. The one that didn't do so well, the worst in the county, and I hate to use negative adjectives, but was Soledad, and they had nearly 47% of their kids that were obese. And quite honestly, there's some other cities that we've done more locally within the cities, and we're seeing that close to 50% of our 5th, 7th, and 9th graders, so these are kids in elementary and early middle school, early high school, that are obese. And so again, when you think of the 80% chance of being obese as an adult, if you're a child or adolescent, doesn't look well for our health.
No, it does not. And not only that, but it's hard enough to be a kid, to go to high school, to go through middle school, and to deal with the challenges of just growing up and being, a preteen, teenager, adolescent, and having this amazing challenge as well on your back must be incredible. Are there differences between ethnic groups?
Yes, there is, and I'm going to use my cheat sheet here.
Oh, please.
But we are seeing differences, and what we see, and there's also differences within the sexes as well. But in one of the national studies, what we're seeing nationally is that Latinos, specifically Mexican Americans, have a higher prevalence of obesity than the non-Hispanic youth. And the worst in the Latinos and the Mexican Americans are the adolescent boys.
Oh.
And they were almost 27% of the adolescent boys were considered obese or overweight.
Wow.
So you think kids, boys. I have a young son, and he is an active kid. Mm-hmm. And you think that's what you think of when you think of kids, at least initially. But now, with increased video games and wanting to watch TV, and then there's other issues. I know that I'm not going to try to steal the thunder of the guests coming up, but there's a lot of other challenges, things that have changed from when we were kids. But that is one of the groups that is the highest risk. The Latinos and the young boys in that age group, which is amazing. The Latina girls are also pretty much at risk. And then the African American young girls are worse as well. So it's sort of Latino boys, Latino girls, and then the African Americans. So we're really seeing that, and really that's in the adolescent age group, so pretty much up to about the age of 12.
Wow. So I think that is surprising. I think of boys, I think going crazy, playing tag, going over here, doing, being really, really active.
Yeah. And you think of why.
Yeah.
Why is this happening? So I am going to steal a little bit of the guest's thunder, but something to think about that might be a good transition is that we're seeing limited access to healthy foods. It's way easier to go to a fast food store than, at least in my neighborhood, than to go to a grocery store.
Yes.
The ads on TV, I mean, it's something, and I remember some of the ads when I was a kid.
But today it's, be young, have fun, eat a Taco Bell burrito with chips in it.
Yeah.
Also with chips in the Taco Bell burrito.
Exactly.
Interesting, yeah.
Exactly. So that's and then the schools, especially with this economy where they've had to cut things down, physical activity and that opportunity to have physical activity has changed. So those are some of the things that we're seeing, and we're seeing them more in areas where there are less opportunity for higher income kids, where they're not having the opportunity to have the playground or the streets that are safe, that don't have cracks in them and all those things.
Well, interesting. That is really, you've talked about a number of things that have still stuck with me. I'm going to cut you off here, though, because we do have plenty more to come with our next two guests. I want to thank you again for taking the time to be here with us today, Dr. Hernandez. It's been, again, a very interesting discussion thus far. Right now, don't go away. We'll be right back. We're going to take a short break, and there'll be more of the Your Health television program coming up in just a few.